what we've got here is something everybody can be proud of, something everybody can use.
We're in many places in the state, but we're in Prince George's County, and we're in Laurel specifically because we want to be. This is a great opportunity for the medical system.
I'm Communications Director Audrey Barnes. Thank you for watching our special program, Healthcare, A New Era in Laurel. Laurel Regional Hospital has been a lifeline for the people of Laurel and northern Prince George's County for decades. As you may know, steps are being taken to allow the University of Maryland medical system to take ownership of the Dimensions healthcare system, which owns Laurel Regional. Once that transition is complete, sometime later this year, Laurel will usher in a new era of healthcare. Joining me to bring you up to date on these exciting changes are Laurel Mayor Craig A. Moe and Dr. Steve Bartlett, Surgeon-in-Chief at the University of Maryland Medical System and Chairman of the Department of Surgery at the University of Maryland School of Medicine. For the last 10 months, they have co-chaired the executive committee of a strategic planning work group that's been evaluating the current healthcare system at Laurel Regional and formulating recommendations about how to transition and modernize healthcare services to be provided at the current site. Thank you both for being with us. Such an important topic. We're glad we can really sit down and talk about it in detail. And Dr. Bartlett, let's start with you. You know, we hear so much about how healthcare delivery is evolving, not just in Maryland, but really across the country. So tell me, from your perspective as a physician, what does that really mean?
Well, you know, Audrey, first of all, it's a great question because it sets the table for the rest of our discussion. But in the past, hospitals and doctors were really encouraged and reimbursed to do as many services as they could and to generate as many healthcare delivery transactions as they could. And that's how they were reimbursed. But now things have totally changed. We're being reimbursed and encouraged to take care of a population of people at the most efficient possible way for the best possible patient experience and the best outcome in terms of high quality. So that doesn't mean we're going to necessarily do more and more services. We're going to make sure a population of people gets good health care.
So really, that's at the heart of this transition that's happening at Laurel Regional Hospital.
Exactly.
So you and Mayor Moe worked together on this strategic planning work group to kind of form the path that we would take. So Mayor Moe, like, who was a part of this strategic planning work group?
We had, you know, doctors, we had elected officials, we had nurses, people that live in the community in the Laurel Beltsville area, and members of the union that were there and involved. So they all came together. We've been working together, as you said, for the past 10 months. And quite frankly, even before that, we were all working on Saturdays, it seemed like, for a long time, and Monday mornings for a while before this strategic committee was put together. But there are 7 committees that we have made up, anything from volunteer to workforce to clinical health and workforce development. Development of the campus itself.
So we know that once you were in place, 2 co-chairs, these committees got together in little subcommittees, right? And they all had specific tasks. What was their kind of overall mission for the subcommittees?
Well, let me take that, because a big part of what your question led into was how are we going to redesign healthcare delivery to be as efficient as possible and give the people of the Laurel area exactly what they need. So we formed committees to look at how is the ER going to work, how the operating room is going to work, how are we going to, what kind of clinical services are we going to deliver, and then we wanted to make sure that we were addressing the critical healthcare problems of the community, most notably in Laurel area and northern Prince George's County, behavioral health. There is, we know from studies that there are not adequate services at this point, and we know from our discussions with the mayor that the police and the fire and the EMS system is really overwhelmed by behavioral health issues. So that was a major focus of what we were doing. But ultimately what these committees did is got input from the community, studied data on utilization of both inpatient, outpatient services, and literally over a 7-month period completely made recommendations on how to redesign healthcare delivery. It was really a fabulous series of reports that we received.
So we know that, you've been working really hard over, like you said, the last 7 to 10 months. But June 5th was a key milestone for the work that you were doing because your executive committee decided and voted unanimously to submit all of these recommendations to the board. How critical is that milestone for this whole process?
I think, as you heard the doctor say, I think it was a lot of hard work by a lot of individuals. We were kind of the co-chair, so we just sat back and waited for everything to come back to us. But the committees themselves worked very hard. They worked independent from the executive committee. We gave certain direction on where we wanted the committees to go. We wanted them to open up and discuss the needs of the community. There's many different reports out there that they also use, needs assessments of Prince George's County for health needs, those types of things, and then involvement within the community. So a lot of hard work went into it. The reports, I think, are very good. Some are technical, more technical than others, but we had the doctors, we had experts there that were able to, to lead the individuals such as myself that didn't understand all of those very technical components. So Doc may have some more.
Well, I was going to say, Doctor, I know that even though the transition is still kind of just, in its infancy, the University of Maryland Medical System and the faculty at the School of Medicine have wasted no time bringing in experts already to try to make the transition
I'm so glad
happen.
you said that,
Yeah.
Audrey, because we're very proud of the engagement of the School of Medicine faculty, both in terms of already being involved in healthcare delivery in Prince George's County, cardiac surgery, anesthesiology, trauma has had a long history, orthopedic surgery, emergency medicine, both in Laurel and in Cheverly. But as the mayor was saying, the committees were chaired by doctors who were leaders in the Baltimore area, head of psychiatry, emergency medicine, orthopedics, and rehabilitative medicine. And the reports were really fabulous, and the work was really intense because we were getting input from a broad background of people in the community. And I have to say, it gave me chills. They did a fantastic job.
So let's talk a little bit about the work that they did do. As the mayor mentioned, there were 7 subcommittees, and they all had a specific mission, things that they were trying to accomplish. And the one that seemed like it really kind of capsulized everything was the campus development. And the whole concept, as I'm reading through the documents, is to create this one-stop shopping campus where you can get everything taken care of. Was that it in a nutshell of what this whole future of Laurel Regional will look like?
That to me, and I don't want to take the mayor's thunder because this is his community and he's really done an incredible job of leading this process. But you look at that campus, it's a beautiful place. It's a place you want to be on. And what we want to now is create a vibrant community where people can get their medical care, but also have a destination they can go to for other things. Perhaps a restaurant, a pharmacy, a wellness center, a place where they can do continuing education. So there's lots of ideas can you come in for how we can build this beautiful campus into really a vibrant destination with multiple purposes, including the best healthcare in Laurel.
Can we talk a little bit about what the different groups did? Like, for example, let's talk a little bit about clinical operations. People want to know, what are you talking about when you say clinical operations?
That one is definitely not me.
That's a doctor question, right?
That's a doctor question.
Let's talk about the emergency room because everybody is familiar with an ER once in a while. Everyone has to go at least once in a while to an ER, so you know what it is. One of the things we've learned is that we need to modernize the emergency room, but still make it available to people who are critically ill. So we're going to have an ER. We're projecting to have 24 bays in a brand new operating room, 4 of which will be secure for people with behavioral problems, 1 of which will be a specialized unit where people who are critically ill can be resuscitated rapidly and then be transported either to the new regional medical center or the university hospital and receive the most advanced type critical care. We're going to have a base station connected to EMS so they can call in and report on patients that are coming and be able to know in advance what's going on. But the best part is we're going to have beds where people can stay up to 48 hours and finish the treatment that's begun in the emergency room. That is really the modern way that healthcare now is being approached in the United States. So that's the emergency room, so completely redesigned. Operating rooms. Again, connect the idea, now you're going to have 2 brand new ultra-modern operating rooms and a procedure room where people can get literally major surgery on an outpatient basis because they have those observation beds. If they get a hip replacement, they can go and stay in an observation bed up to 48 hours and then go right to a rehab facility. Major abdominal surgery, dental surgery, podiatry, so all kinds of major clinical operations will be possible in this new facility.
That's one of the things that we kept hearing was that we want to stay in our community and be treated. We want to have follow-up where we can go to the campus. I think you're going to see those things, and people can go and have, as you just heard them say, they can have some surgery. They can stay in there for up to 48 hours. So they're going to be in their community, and if it gets to be at a different level, they can be transferred to one of their other facilities. But I think that's the important thing that we kept hearing, that people want to stay in the community.
One thing I also thought was very interesting when I was looking at what the work that the subcommittees did was the things like behavioral health, for example, the outpatient addiction services and things like that. You'll be able to get that right here in Laurel on that campus.
That's exactly been part of the design. And one of the key things that is changing in America is that we need to be able to provide people with immediate evaluation without going to an emergency room, where somebody who says, I can't take another day, can see someone right now walk in and be evaluated and be directed to the right type of treatment on the spot. And that's a new important capability that we want to make sure Laurel has available. But we do want to make sure that the critical needs of Laurel are met on-campus services. We know there's a higher incidence of asthma in the Laurel community, and so we want to have respiratory care and asthma evaluation, and people with emphysema will be able to have treatment. You mentioned women and children, so we want to have women who are expecting be able to have all of their pre and postnatal care done in Laurel, deliver the baby in one of the places that they choose, whether it be the university, Holy Cross, the new regional medical center, wherever they prefer to go, they can go. And diabetes care is another major, and obesity is a major health need in the area, and we want to assure that they have access to that. Cardiac care, I mentioned that we have a cardiology and cardiac surgery program in the new regional medical center, and we'll have a capability for people to have the full services on the Laurel campus. So it's exciting.
Mm-hmm. So all of it's exciting. And all the subcommittees have now made their recommendations and their presentations to the executive committee. You've sent that to University of Maryland to evaluate. Overall, what did you think of the recommendations that you heard? I mean, the voluminous amounts of good ideas came out of these committees.
I think we unanimously voted to approve the reports, and I think all members of the executive committee.
It's 11-member committee.
11-member committee. The mayor did a great job of going around the room and getting feedback from every member of the executive committee. Nobody was able to just sit silent. And we got unanimous support for the recommendations. As the mayor said, we're now processing that into an actual, how do we now make the rubber meet the road, and take the conceptual recommendations and now put them into an actual clinical program in a physical facility.
Now, we did have a workforce development group, that subcommittee that worked very hard. Part of the union was involved with that, people that worked at the hospital, also community members. And I don't have the report in front of me, but there was a lot of good information that was provided on grants, on if those services are no longer available or they're moved to the regional medical center, what these individuals can and can't do, and where they might be able to get help for, seeking a job.
That was one of the most detailed subcommittee reports that I read, was from the workforce development. It's actually creating like a transition team to make sure that current employees get kind of funneled to some of the vacancies and things at the hospital.
And I'm glad you said the word vacancies, because there's going to be many. Because as you know, what's going to really happen, stop and think for a minute. Before the University of Maryland engaged with a proposal with Prince George's County and Laurel to take on this new healthcare system, most of the residents of Prince George's County were leaving the county to get their health care. 62% of people will leave the county to get their health care. We want to reverse that trend. Have people get health care in the county, in their the area right around their home. What is that going to do? It's going to create jobs. It's going to mean we're going to need more nurses, more respiratory therapists, more doctors, more of everything. So yes, there's going to be some tides where people may work here, now they work somewhere else. And the Workforce Development Committee is going to be very focused on helping us make that transition, so people may be doing their job in a different place, but ultimately there's going to be many, many more jobs.
What do you think the chance is that they will adopt the recommendations of these subcommittees?
I can tell you I'm part of the groups that are sitting analyzing these reports, and they're not changing much at all. We're pretty much adopting what's been recommended. They were feasible, well researched, and really represented the true community need. So we're not. It's actually remarkably easy to translate these reports.
That's breaking news. I didn't know that.
Right. Okay.
I didn't know they were looking at them yet.
That's good. So Mayor Mo, does this mean the work of the strategic planning work group is done? Are you guys finished?
I don't know. I think the community has to stay engaged. I think the elected officials need to continue to work together. Is it going to be that everything everybody wants? No, but I think it's going to be something we're all very proud of, and something that will meet the community needs. And I think that's the most important thing.
December 31st was the day that all the services were supposed to stay in place, at least through then. So if I'm watching this as a resident, and should I be worried about what happens on December 31st if I have like a critical illness or a relative that gets sick? Am I going to be able to go to Laurel Regional Hospital and get taken care of?
You will, and you certainly will have a clearly articulated transition. First of all, the ER will continue to remain open, the operating rooms will remain open, and the majority of the clinical services, as you see them now, will transition in a very seamless way over time. And the major turning point will be when the new freestanding medical facility is built. We cut the ribbon on that, and then a lot of what you see in the hospital will transition into the new facility. So all of that will happen over time, but all of that will be preceded by a very thorough communication process so people understand where to go for what they need.
Final thoughts?
We want to keep, as I said, everybody engaged. We're not done yet, and we're still working with the university. The community needs to stay involved. As I just said, there still is a public hearing that has to be done, and we want the community to make sure they're involved and make sure that they express their views. The
University of Maryland School of Medicine, University of Maryland Medical System, it's a very big enterprise. We're in many places in the state, but we're in Prince George's County, and we're in Laurel specifically because we want to be. This is a great opportunity for the medical system to bring its leadership to this community, and we're here because we want to work with this community. It's a great place.
Well, thank you both so much. We learned so much just speaking with both of you about this, and we really appreciate it, Mayor Mo and Dr. Bartlett.
Thank you.
Thank you very much for being here.
Thanks, Doc.
That does it for this special edition of Laurel TV. I'm Communications Director Audrey Barnes. Stay tuned for information about public hearings as we continue down the path towards a new era of healthcare in Laurel. Thank you for watching.